Senator Gallego, thank you for the opportunity to share this message with you. My name is Ana Santiago, and I'm a constituent from Arizona, as well as a social work student at Arizona State University. I followed your work, especially your commitment to expanding veterans' healthcare and lowering costs for working families. I really appreciate the leadership you've chosen on those issues. As a future social worker and someone who deeply cares about health equity, I'm here to ask for leadership on a needed reform for the Affordable Care Act, or ACA, specifically improving how the premium tax credit is calculated. Senator, while the ACA has expanded coverage, many Arizonians are facing a different problem: under insurance. People technically have insurance, but they cannot afford to use it because the deductibles are so high. I'm here today to advocate for shifting the benchmark from the premium tax credit from the current silver plan to the gold. It's a simple fix with huge implications for financial stability and health outcomes for Arizona families. Here's the issue. Right now, premium tax credits are tied to the second lowest cost silver plan, which covers about 70% of healthcare costs. That keeps premiums low, but it traps families in plans with extremely high deductibles. Research from the Commonwealth Fund shows that the median deductible for a standard silver plan is over $5,000 for a working family in Arizona, earning just above the poverty line. Having to pay the first $5,000 out of pocket is simply not realistic. And according to the Urban Institute research of 2020, from 2025, the deductible can eat up as much as 21% of a family's yearly income. The solution is to shift the benchmark from the silver to gold. Gold plans cover roughly 80% of costs, offering much stronger protection. If we update the benchmark to gold, subsidies would rise enough for families to afford plans with far lower deductibles. The data shows this shift would reduce average deductibles from the $5,000 closer to $1,450. That's the difference between skipping care out of fear and actually seeing a doctor when you need to. This really is a social justice issue. Right now, we have a two-tiered healthcare system. People with higher incomes or solid employer coverage get real access to care, but low and middle income gig workers, service workers, and small business owners are stuck with plans that look good on paper but function like catastrophic coverage. Over 423,000 Arizonians enrolled in marketplace plans for 2025. Many of them are in plans with deductibles so high that their basic right to health is compromised. Studies show that these high deductible costs drive medical debt, especially in low-income households and communities of color. And they push people to delay or avoid preventative care. And when people avoid preventative care, they end up in ER later with more serious conditions and higher costs to the system. Senator, you've never hesitated to call out when veterans are treated unfairly. I'm asking for that same level of commitment for working civilians struggling with these financial barriers. I'm asking for two specific actions. First, that you co-sponsor and introduce legislation to permanently shift the premium tax credit benchmark from the second lowest cost silver plan to the gold. Second, that you bring this proposal to the Senate Financial Committee as a cost-saving measure. Lowering deductibles means more preventative care and less uncompensated emergency care. Ultimately, saving taxpayer dollars. Your constituents deserve insurance they can use, not just insurance that looks good on paper. By leading this reform, you can ensure that healthcare in Arizona is not just accessible, but truly affordable. Senator, thank you for your time, and I look forward to seeing your support on this important issue.